Welcome to Hypnotherapy. I'm sure many of you have seen or maybe even participated in hypnotism done at an event like prom. You and a few classmates are up on stage, surrounded by an audience. You all will have your eyes closed, and when the host counts backwards from 3 and snaps his fingers, your friend Jerry begins to waddle and quack like a duck without hesitation. The audience bursts out into laughter, unfortunately, because this entertainment aspect of hypnotism is widely misunderstood, feared due to people seeing it as a mind control. Thankfully, there has been a lot of research done on hypnotherapy and is now becoming much more important in the world of mental health.
Hypnotherapy is a type of psychotherapy. The goal is to decrease the patient's emotional discomfort, increase the patient's social functioning, and increase the patient's ability to perform appropriately in a given situation. During hypnotherapy, the patient is in a deep trance, not asleep like many people think. Once the patient has entered the altered state of consciousness, the therapist will begin using various techniques, helping the patient explore their subconscious and hopefully unlock whatever it is they are trying to face. It is important to remember hypnotherapy is not magic and oftentimes takes multiple sessions and even self-hypnosis techniques to be successful.
Anyone who has made the conscious decision to face their concerns and work toward bettering themselves makes a very good candidate for hypnotherapy. As you can see on our blog, we have listed out many possible candidates, but today we have decided to focus on 2. Patients who are experiencing PTSD and also students just like ourselves who have extreme anxiety and stress when it comes to exams. Trauma can cause a patient to disengage from their own sense of safety, which is why people who experience PTSD make great candidates. Oftentimes, trauma victims with PTSD experience reoccurring, troublesome, and intrusive memories of the incident. Hypnotherapy does not erase the traumatic event. Instead, it allows the patient to directly address the event and address the effect that it has on them. Emotions are typically very high during these sessions, which is why it's important to go to a therapist that you can trust. The goal of repeated sessions is for the patient to be able to cope with the trauma and learn how to gain a sense of normalcy in their everyday life. Hypnotherapy can also be used to treat a wide variety of anxiety disorders, including the stress and anxiety we as students experience when it comes to taking exams. Hypnotherapy can be used to boost confidence and reduce feeling anxious. During the session, the hypnotherapist may ask the patient to focus on the physical sensation they feel when they're stressed. The therapist will then feed the information to the patient such as, "You are in control, you know this information." The idea behind the suggestion method is that when you start to feel overwhelmed or stressed when it comes to the exam, the suggestions and visualizations will then come to your conscious memory and help you cope better.
There are many benefits to hypnotherapy. I'll be telling you about 6 different health benefits hypnotherapy has. 1 is trouble sleeping, insomnia, and sleepwalking. It can be helpful if you sleepwalk, have a struggle with falling asleep, or even staying asleep. It can train you to wake up when you feel your feet hit the floor and help you avoid sleepwalking episodes. Learning self-hypnosis techniques can increase the amount of time you sleep and the amount of time spent in a deep sleep. Another one is anxiety. Relaxation techniques, which include hypnosis, can sometimes ease anxiety. It tends to be more effective in people whose anxiety stems from chronic health condition such as heart disease, rather than a generalized anxiety disorder. How it works. It encourages your body to activate its natural relaxation response through the use of a phrase or nonverbal cue. Slow breathing, lowering blood pressure, and installing an overall sense of well-being. IBS is another one that helps, irritable bowel syndrome. The effectiveness of hypnosis on IBS has been proven in clinical studies consistently. It leads you through progressive relaxation, providing soothing imagery and sensations to combat your symptoms. Chronic pain. People with pain related to conditions like arthritis, cancer, sickle cell disease, fibromyalgia, migraines, and tension headaches, or pain after surgery. How it works, it can help cope with pain and gain more self-control over your pain. Studies indicate that hypnosis can do this effectively for long periods of time. Another one is to help people quit smoking. Many people have found that hypnosis has helped them kick the bad habit of smoking, but research is still out there. It works best if you do a one-on-one session with a hypnotherapist so that they can customize it to match your lifestyle. For it to work, you need to truly want to quit smoking. You need to find a healthy replacement action like chewing gum, and 2, train your mind to associate smoking with undesirable feelings like a bad taste. Weight loss is another one. Like smoking, there isn't many studies to confirm the effectiveness of hypnosis on weight loss. Modest weight loss of 6 pounds over 18 months has been shown through some studies. It is most helpful when in combination with diet and exercise. When you're hypnotized, you are more likely to focus your attention and listen and respond to suggestions for behavior change, such as eating healthy and exercising.
Hypnotherapy cautions to be aware of. If there is alcohol or drugs in the patient's system, then this will be more than likely to interfere with the trance and also the therapeutic of the therapy. If the hypnotherapist suspects the patient is under the influence, they will not proceed with the session. Another caution to be aware of: people that suffer from delusions, hallucinations, or psychotic symptoms might not be the best candidates for hypnotherapy. Patients with many personality disorders are not recommended to do this also. The hypnotherapist will need to consult with the psychiatric doctor to see what their opinion is if the patient is able to do hypnotherapy. If hypnotherapist proceeds with the hypnotherapy, it could very well end up soliciting the patient's other personalities while in the trance, and you will have a situation that you may not want to be in. Also, patients that want to have a regression to uncover past sexual assault or physical assault of abuse by a relative or a known person, a hypnotherapist will have strict boundaries set for that. For example, the hypnotherapist will record the entire session and have a close relative sit in on the session as a witness. So in case any evidence in the court of law would have to be used, they actually have the proper evidence that they follow through with their strict restrictions on hypnotherapy with regression. Also with hypnotherapy can sometimes result in the creation of false memories. The belief that something happened even though it never did. False memories are also called confabulations, which is the most dangerous in hypnotherapy. For example, I did try finding one that was a little more serious, but wasn't as easy as I thought. But a false memory is like believing that you started your laundry before you left for work and you never did. Or maybe somebody thought they killed somebody and never did. You know, little things like that can trigger something different in somebody's mind. So cautions to be aware of is very important in hypnotherapy.
Overall, the therapeutic uses of hypnosis for hypnotherapy have helped many people change their habits, lessen symptoms, and treat a variety of conditions. If you or someone you love is interested in seeking help through the use of hypnotherapy, there are 2 essential things you need to keep in mind for a possible success. The first is you have to believe in hypnotherapy as a psychotherapy. If you don't believe in it and you go into your session thinking that it's silly or a waste of time, that's exactly what it's going to be. You have to have an open mind. The second thing you need is trust. You need to trust your therapist because it is their job to dig into the deepest, darkest corners of your mind in order to help you. And if you don't trust them, your body's going to lock them out and you won't find a success through this therapy.